Hello, everyone. In the light of the recent pandemic, we've been talking a lot about COVID, and I decided to use the fact that I'm given the mic just to talk about other diseases that unfortunately still exist and are quite forgotten because of this big scare, even though we know a lot more about STIs and STDs than we do about the new coronavirus. So I'll first go very quickly on herpes because herpes is caused by a virus that over 50% of the population worldwide has. There is no known cure for it. The symptoms are quite mild. Well, not at first. You get a sore that comes back every time that you are stressed, but over time, the sores come back less often and less often. Um, Now on to another type of disease that I want will not want to go too much into details is the list of hepatitis. There are various types of hepatitis. Fortunately, there are vaccines for all of these. So this, I feel, is not the one I should be spending my time with prevention. Now, um, let's start with the most famous STI there is, HIV, the human immunodeficiency virus. What is it? It is a retrovirus that gets into your cells and replicates there and feeds off of your immune system. So per se, it has no real symptom. About 2 weeks after first getting the virus in your system, some people experience symptoms. They can be a flu, or it can be a rash, or it can be feeling tired all the time. But many never have those first symptoms, and they just do not know they have HIV until they get tested for it, or until they go on to the next stage, which is a disease caused by HIV called AIDS, the acquired immunodeficiency syndrome. Um, this is the disease that kills because you no longer have an immune system working, and therefore bacteria that normally live inside you, inside your digestive tract or on your skin, are able to kill you because they overpower you. Now, there was a time having HIV was a death sentence. Now in 2020, it is no longer the case. There are various ways of fighting against it. Uh, the first one that I would want to mention is TasP, which stands for Treatment as Prevention. What is that? Well, scientists have discovered that people who were treated correctly with the right doses of medical drugs were no longer contagious. So this is why it is very important to get tested very often, because you do not have any symptoms. But as soon as you have it, you can get this treatment as prevention to make sure that you're no longer contagious and you will stop the virus from propagating. And research also showed that this treatment is very effective. So this is where PrEP and PEP come in. PrEP stands for pre-exposition prophylaxis. And the concept is to get the HIV treatment before taking any risk. And that makes your body inhospitable. So if a risk is taken and the virus does get into your body, your bloodstream, it cannot replicate and it just passes through and does not infect you. PEP, or PEP, is the acronym for post-exposition prophylaxis. And that is the treatment that you should get if you have been exposed to a risk. Go to any emergency room, up to 24 hours. Some will accept you up to 48 hours after the risk was taken. You will be given a cocktail of the same drug, but very potent, to make sure to eradicate the virus. If you go there in the first 20, if you started in the first 24 hours after the risk, then you have 90% chances of eradicating the virus from your body. Now, the thing is, you can say, yes, sure, we can also be abstinent or monogamous, but there are other ways to give on this, to have this disease. It is a blood-borne disease, and so there are things that not everyone thinks about. Obviously, we think about drugs and sharing needles, but do you ever think that sharing your toothbrush with someone was actually the same as having sex with them without a condom? Do you ever think that sharing a razor with someone had the same effect? Well, not many people do. Now I will go on to the bacteria. A bacteria called treponema pallidum is the bacteria causing syphilis. Now, syphilis is a very serious disease. It is the disease that eradicated half the population in North America after European colonists imported it. The transmission is basically the same as HIV. However, it is much more contagious than HIV. Syphilis has 3 stages. The first stage is chancre, which is basically a little sore that is painless and is located in the point where the bacteria enter the body. So if you're on the receiving end of sexual intercourse, it might be located inside your body and you don't even notice it. Then, if you do not notice it, if you do not treat it, it goes on to stage 2 syphilis, which has a huge variety of symptoms, which is the reason why syphilis is also often called a silent disease, because it can be confused with other diseases. You can get rashes, you can get bone pain, you can get joint pain, hair loss, fever, you can be constantly tired, fatigued, have headaches, fevers, and many, many more. I will not give you the full list because not everyone has all the symptoms. And the problem is, those symptoms also go away on their own if they are not treated. And 3 to 15 years after the first infection, syphilis will have moved on to your nervous system or anywhere else because the bacteria eats your body and it can create really serious change. Luckily, syphilis is still known to react to antibiotics. Contrary to the next bacteria that I am introducing, which is neisseria gonorrhea. So the bacteria causing gonorrhea. Gonorrhea can also be symptomless, mostly for women. Most men experience symptoms. The symptoms are a discharge, and if you have it in your urethra, you will feel a burning sensation while you are urinating. The gonorrhea is rather mild in that sense, but unfortunately, it has become resistant to almost all types of antibiotics. There are even 2 strands, one in Hawaii and another one some other place in the world I can't remember, that are super resistant and even resist penicillin, so be careful with that. Another bacteria-caused STI or STD is chlamydia, caused by the bacteria Chlamydia trachomatis. The symptoms are very similar to gonorrhea, so a discharge from the urethra or from the rectum or in your throat, depending on where you have it, a feeling of burning when you're urinating or swallowing or whatever. However, this can lead to more serious problems. For example, in women, since it can be symptomless, it can lead to fatal ectopic pregnancies. Ectopic pregnancy means that the woman is pregnant outside the womb. And it can also lead to blindness. We're not gonna kink shame. You can get STDs wherever. Now, I am not one to tell you that abstinence is the only way to not get any disease. I am a very strong advocate of condoms. There is one thing, though, that I find very sad is that unfortunately only one type of condom is marketed around the world and known everywhere. It is the so-called male condom. I do not like to talk about male condoms and female condoms, but that's a different story. So the male condom, as you know, is the one that you put on the penis. To conclude, I really want to let you all know of the existence of the female condom, or as I prefer to call it, the inner condom. The concept is basically the same as the one that you put in on the penis, but you put it inside. Um, so you have to know your anatomy and be willing to push it up there, usually with fingers or whatever. However, if you are putting a condom inside you, that is probably because you're expecting to put something else later. So this should not be a problem. The advantages of the female condom is that it can be placed hours before intercourse. And so if you have partners who do not who do not like to put on condoms themselves, or if you feel that there might be peer pressure or that there might be violence or that you may be too drunk for anything, ladies and bottoms, please look into this. I see that my time is up, so that will be up all for now. Thank you very much.